And we're moving into the forearm, wrist, and hand, looking at conditions such as lateral epicondylitis or tennis elbow, medial epicondylitis or golfer's elbow. These are inflammations and irritations that are typically chronic of the forearm extensors for tennis elbow and the forearm and wrist and finger flexors, of course, for golfer's elbow. So most people complain about pain at the lateral epicondyle. That's the attachment of the long finger extensors, extensor digitorum communis, extensor indicis, extensor digiti minimi, and then farther down the arm you have some of the thumb abductors and extensors coming in here as well across the radius. So it's very easy to treat the whole area with cups. I don't like to treat just the lateral epicondyle because the problem is typically involving the grip in the hand, not so much the actual epicondyle. To check some of the functional changes post-cupping, I'd recommend to do a Jamar hand wrist dynamometer grip. So squeeze my fingers. So using the machine, of course, squeeze and hold and measure the maximum on hand grip with the dynamometer before and after using the cupping to see if there's a change. You could also check for range of motion. If they have chronic lateral epicondylitis, they tend to get very stiff in the extensors, which will limit flexion of the wrist and fingers. So using a goniometer and then measuring wrist and finger flexion extension, let me just take this, oh, good. You could actually see the difference. Now this goniometer is a little big for that, but you get the idea that you can measure the changes in the range of motion. So let's get to the cupping. Again, when there's some body hair, you want to use copious amounts of lubricant so you get a good seal with your cup. Place the cup, let the tissue pick up. And I have him in a nice little foam roll piece here for good positioning and relaxation. And this cup might be just a little big. I might be able to just work with the bigger cup where you have more of the fleshy part of the muscle. So up around the elbow. And we're a little bit tight up there. You feel that pulling? In this case, you want to switch to a smaller cup. These stepped cups are good for static positioning. So if I wanted to just leave a few on for a period of time over some trigger points, I may do 5 minutes or so with the static cups. You could also, for static cupping, use the cupping gun and some small cups. These have all different size openings, so it's a little easier for a smaller area such as the forearm to use them. The stepped cups typically don't glide all that well. This one's giving me some glide, but they tend to pop off easily. The suction cups with the pneumatic gun. Place the cup on, place the gun, pump up, detach, and you can get some gliding with these as well. These often have to be pumped up repeatedly, which makes it easy if you have a suction pump with a long tube like a straw, because I can move. That's really tight. Okay. I can move the gliding cup and adjust the suction as I go and work through all of those finger and wrist extensors. To get a nice separation, they tend to get really bound down, making it very hard to get a good grip, painful grip, and a weak grip. So you want to get the circulation in there, and the pumping really picks it up nicely. Pumping also tends to make less ecchymosis because you have some of the pressure is on, some of the pressure is off. So you can repeatedly pump and glide and pump and glide, especially over the bony area of the epicondyle. Very hard to get a good suction effect there. And pump and glide. So it's a nice combination, and having something to keep the person's body part in place, such as the little positioning devices, makes it easy. Otherwise the arm's rolling all over the table. Now moving on to the opposite side of the forearm, we're just going to let this flip over and let your arm extend out this way. Is that comfortable for you? Mm-hmm. It's a nice way to grip. I can come in with the traditional cup. Make sure we have him lubed up well. So for golfer's elbow, which is medial epicondylitis, also something typically due to too much gripping, you can get a nice slide. Here, because there's less body hair, the cup isn't losing suction as readily as it did on the dorsal surface of the forearm. Sometimes I'll take a cup and just pick up the palmar fascia. How's that feel on your hand?
Interesting.
Very hard to grip the palmar fascia, so you can get a nice grip here if we get a little close up there. Turning and twisting really picks up, so people who have those Dupuytren's contractures, some people who slice their hand open while cutting a bagel. You tell we're from New York. We love our bagels. So gliding the cups there, very, very effective. And be ergonomic for yourself. Switch hands once in a while. Don't be all doing the cup strictly gripping with one hand. Switch. And the turning, torsioning the cups works really nicely here. You know, you got that no man's land in the middle of the hand. And you want to open up that palmar fascia. So people who have had Colles fractures, wrist fractures, gets really tight in the palmar fascia. Sometimes I'll just use the stepped cups and just leave one holding. Or I'll even tell the patient, you know, you can give a little pull on this with your hand, and you can kind of stretch that where it's tight and pulling. Okay, so too much pull, then just press in with your finger, plant it, and now try again. So see if you turn a little bit and just a slight pull. You play with the pull to see just enough that you feel a stretch, but not so much pull that you dislodge the cup.
Mm-hmm.
You feel like there's that lifting sensation?
Mm-hmm.
So that's nice to do. We have the fancier stuff here with the suction gums. You can rest your hand now. Which is a two-hand technique, of course, but you get, look at how that bulls up. If you get a close-up on there, you can really pick up the palmar fascia because it's very hard to mobilize, almost impossible to skin roll, but you can do quite nicely with the cups and get some nice blood flow in that area. So a little tendinitis in the thenar eminence, also nice thing. Move that thumb around for me a bit now. So you can do a little range of motion, bend it in and out, straighten it out, open and close and open. So you could get him to mobilize on his own while the cup is in place and make circles. You feel the pull from the cup?
Mm-hmm.
So that opens up nicely, and reverse circles. Nice big open grip. So people who tend to get that trigger finger, I'll come in even with a smaller sized cup. Dislodge a previous one. Going to use a little bit more lube here. So when you get the tight tendons, you know, post-surgery, post-injury, place your cup right over where the tendon's coming through. Start with a little suction, see how you do with that. And as you roll and twist the cup, you could get a little more grip. It dislodges, pick up again, and start to work that area. A little harder to get over the finger because the cups are just too easily allowing the air to seep in, but you could get over the fleshy part, which is really where you want to be moving the cups. So nicely smaller cups for a smaller area. If you want to get over the hypothenar area. I had a yoga teacher who sliced her ring and pinky fingers and couldn't open her hand. So getting the cups in, she had tremendous scarring right in this area, right over the tendons. Fortunately, she didn't break the tendon, she just nicked them a little bit. But turning and rotating the cup as you go is a wonderful way to mobilize. Let's get a real close-up on that. So turning the cup, loses its suction, unspin. Let's get a nice close-up there. Pick up a good amount of skin here because you need a good grip. You can see it really reddening, picking up that circulation. Get right in there over those tendons. So I kind of make a little sinusoidal wave back and forth, turning, twisting, clockwise, counterclockwise. It gets a very nice grip, and then finish with some nice massage of the hand, moving, of course, circulation back to the heart, and then follow with some exercise as well for the range of motion, strengthening, whatever else you have to do.